I'm looking for something to help me quit smoking. I had
Okay.
a small heart attack a week ago, and so I need to. I
Oh, okay.
need some help.
Okay, perfect. Well, I am the right person. I'm Himali, and I'm the student pharmacist here, so I could definitely help you with that. Now, have you been to a pharmacy before?
Yes, I have.
So I'm just going to pull up your file and see what medications you're currently
Okay.
on. What's your last name?
Johnston. It's Nicole Johnston.
Okay. And what's your date of birth, Nicole?
I don't know.
8th
8th of August, 1953.
Perfect. And are you still at 44 Rigger Drive?
Yes, I am.
Okay. And so I see you were on the baby aspirin once a day, the heart pills, the blood pressure, and you still use the nitroglycerin spray?
I've never had to use it. They just gave me a prescription for it
Oh, I
from
see.
the hospital, but I've never had to use it.
Oh, okay, I see. But do you still carry it around with you?
Yes, yeah.
Okay. Okay. And then you're also on the cholesterol med. And are you taking all of these meds currently?
Yeah.
All of
Yeah.
these that I listed?
Yeah.
Okay,
The
you're currently
cholesterol one
taking
I've
them.
been on for quite a while, but
Okay.
the others are just new.
Okay, so the blood pressure and the heart pills, they're both new.
They
for
just
you?
started
just
me
a
on
week
those
ago.
in the hospital.
Okay,
Yeah.
I see. And so your major concern today is your quitting smoking. So now regarding that, how long have you been smoking?
I've been smoking for 30 years.
30 years, okay. And how much do you smoke per
About
day?
25 or 30 cigarettes a
So
day.
that's about a pack a day.
Yeah.
Okay.
Yeah, a little more
Okay.
sometimes.
And more about your smoking habits. Do you smoke throughout the day? Do you have fixed times? If you work, do you smoke during all of your breaks and stuff like that? Or how would you describe your smoking habits?
Well, yeah, I smoke a lot of the time, and then sometimes at home, or my husband smokes as well. So
Oh, I see. And has he been smoking for a long time as well?
Yes.
Okay.
Yeah. Yeah.
Okay.
So I haven't had a cigarette for 7 days.
Okay.
But now I'm starting to have some symptoms, and I'm headachy and a bit shaky, and
okay.
my husband seems to think I'm cranky.
Okay, and what did the people at the nurse or the pharmacist at the hospital suggest you do? They just asked you to quit
when
right
I was
away?
in the hospital, they had me using a patch, but
Okay.
then they didn't. That wasn't something they suggested I continue on with
Oh,
or
okay.
anything. They didn't give me a prescription for anything.
Oh, I see. Okay, so you were on the patch for all 7 days when you were at the hospital?
Well, I
then?
wasn't
Or
in
a
the
few
hospital that
couple
long,
days?
but yeah, just because I was having withdrawal symptoms in
Yes.
the hospital.
Yeah.
But I haven't
Do you
used
remember
anything.
the name of the patch by
No.
any chance? Okay.
No, and yeah, and I
And
haven't.
when you at this discharge, they didn't recommend anything or didn't
No.
ask you to use anything at all?
Well, and I thought I'd be okay, but
Okay.
I'm just starting to have some symptoms
Yes.
again.
Okay, well, I can walk you through what options are available. Before that, since you've had the heart attack, it is a contraindication. It is a risky factor to use with nicotine replacement therapy, which is usually available without any prescriptions that you can try yourself without having to go to a doctor. Most of them is at least 2 weeks after any severe heart attack or heart conditions. Since it's only been a week, I can definitely walk you through what products are available, but I wouldn't recommend you start using them at least for another couple weeks.
Okay.
But since you do want to start right away, you do not want to start smoking, right? Like since
Right.
you've already stopped for a little bit of a time,
Yeah.
you want to continue on with that. Okay. And would you say you at the evening time? Has your husband ever considered smoking?
Quitting smoking?
Yes, or quitting. Sorry,
No, not really.
no. And did you ever think about it before you actually had your heart
I have
condition?
tried. I tried once before, but it only lasted a day.
Oh, okay. And you didn't use any products. You just
No, I
decided
just
you don't want
tried.
to quit.
Yeah.
Okay.
Yeah. So I've never tried anything other than just the patch.
The patch
for
so at the
in
hospital.
the hospital. Yeah.
Okay. Did they tell you what kind of a heart condition you had that you were hospitalized for?
Well, they told me it was a small heart attack.
A small
That's
heart
what
attack. That's
yeah.
all they said.
Yeah.
Didn't say if
Yeah.
it was an MI or.
Well, yes, they did say it was an MI.
It was an MI.
Yeah.
Okay. Okay. Perfect. So specifically for MIs, with the nicotine replacement patches, it's at least 2 weeks break after you've had that heart condition. So I
Okay.
wouldn't recommend you to use anything right away yet. But since you want to use something, there's prescription medications available that you could start right away, and not have to start smoking because of your symptoms. Or if you do not want to try prescription stuff right away, you could go into using something for your withdrawal symptoms for like a week or so, and then come back in. Well, either way,
Okay.
you'd have to go see your doctor because if you want anything for your withdrawal symptoms or want to quit smoking using the prescription products, since you cannot use the nicotine replacement therapy, you'd have to go see your doctor. But I can definitely walk you through what products there are that you wouldn't need to see a doctor and you'd have to
Okay.
wait
Okay, that would be good.
a week to start before you can start using them.
Okay.
So there's gum that's available. There's lozenges, there's patches, and there's inhalers. Now, based on your habits, since you said you smoke throughout the day, and is it more of an organized kind of, or just every
It's
now and then?
whenever.
It's whenever.
Yeah.
Okay. So
Yeah.
with smoking like that, with a gum, if you use a patch, it's more of an constant release throughout a day, and usually you just put a patch on your body, and then it's good for 24 hours. So once you put it on, you don't have to worry about it. But if you're concerned about any triggers or having to have something to do with your hand, since you're in the habit of using
Yeah.
the hand to mouth motion, you can use the gum. Now with the patches, it's a fixed dose, so you cannot really adjust the dose. If you start at a 21 milligram dose, that's what you get. You cannot really adjust. The good thing about the gum though is that you can take as much as you want, up to a maximum of certain number, like say 40 pieces of gum per day. But you can adjust how much you need or when to take the gum. Whereas compared to the patch, you just slap it on and then you have to let it do its own thing. You can't really do anything about how much dose you get.
Okay.
So for the gum, usually since you start a smoke more than a pack, about a pack a day, I'd say you start at 4 milligram gum, and it's 10 to 12 week that we give for a patient to try the product and see if it's gonna work when they were trying to quit, right?
Okay.
So you try the 4 milligram for about 6 weeks, and you can chew a gum every 1 to 2 hours for the first 6 weeks. Now, since you were smoking about a pack of cigarettes a day, you'd probably want at least 9 pieces of gum in a day, at least.
Okay.
And depending on your cravings, you can go every 1 hour or every couple hours, or if you don't crave anything for maybe say lunch to dinner, you don't have to chew a piece, right? Depending on what your craving is like, you can decide to chew as much as you want or as little as you want.
Okay.
Now, if you do decide to use the patch because it's not so much to remember, you just put it on and forget about it, you can definitely use a piece of gum for breakthrough cravings. So say the patch is working fine, and then if you get up in the morning and that's when you have the desire to smoke, you can just chew a gum right in the morning.
Okay.
There's lozenges. Some issues with lozenges are you have to let it sit in your mouth for about 20 to 30 minutes to let it dissolve, because you have to suck on them and you can't chew them. So I don't know if that you'd be
Yeah.
interested in that or not.
No.
There's inhalers that you could use. It's a lot. It works best if you constantly keep puffing. So this might also be a good idea if you do need something to do with your hand.
Yeah, that's not so important.
Also, yeah, exactly. Also, like depending on where your working conditions, you won't be able to use them so much as
Yeah.
well. So definitely, if you want to try the patch, these are really easy to follow since there are steps 1, 2, and 3 that are available outside. So step 1 is the highest dose one that you start with, and you go on step 1 for 6 weeks, and then you move down to step 2, which is the next lower dose for 2 weeks, and then you move down to step 3, which is the next lower dose for another 2 weeks.
Okay.
So it'll be about 10-week program that you would have to keep taking the patches for. Now, do you have any skin conditions?
No.
No, because the patches are sometimes a concern with people who have some
Yeah.
dermatological
No.
conditions, but you're okay with that, and you're not allergic to anything at all?
Yeah. No. Well, sulfa. I'm allergic to sulfa.
You are allergic to sulfa. Okay, but not not latex or any adhesive that you know of.
No.
Because some people do have issues with the adhesive that they use in the patches. So if that's not a big problem, then it should be okay. And with the patch that you used in the hospital, it should be okay too. So there's that. You can try a box of gum just with the patches if you do want to start the patches for breakthrough cravings. You don't have to chew on it at all. Although with these, since you cannot smoke while you're on these, because that's going to increase your nicotine level a lot higher than what you need. So since you haven't smoked, so that shouldn't be a concern for you.
Okay.
Now,
All right.
do you have any preferences or any questions about these products?
No, I think you've explained them fairly well. But you're saying I shouldn't do this until I go
Yes.
and see my doctor. Go see my doctor and
At least a couple weeks, I would say, because of the heart condition. Do you have a follow-up visit with your family doctor? Should I continue? Not
No.
finish? Okay.
No.
Okay.
okay. How'd she do?
Do you want to stop?
Oh, yes.